Hello, everyone. We are Group 3 from Public Health 806, and today we will be presenting our poster on community interventions to combat childhood obesity. This poster proposes a prospective cohort study examining the impact of public park and farmers market accessibility in decreasing the prevalence of childhood obesity through physical activity and vegetable consumption, all studied amongst 4 cohorts of children in urban communities. Increased physical activity and vegetable consumption are expected in the cohorts receiving interventions, with the greatest decrease in childhood obesity prevalence expected in the group receiving the combined effects of park accessibility and the farmers markets. With the rising prevalence of childhood obesity, the results of these interventions will provide valuable community-level insights into decreasing childhood obesity and will generate actionable evidence to guide policies supporting healthy lifestyles for urban children.
Our first and foremost goal is to encourage healthier lifestyles in children and families by promoting nutritious food choices and regular physical activity. We also want to contribute to a 15% reduction in childhood obesity prevalence in urban environments by increasing access to healthier food options and safe spaces for physical activity within a 5-year timeframe. Another goal is to increase public park utilization by children and families in targeted urban areas by at least 20% within 1 year. We plan on achieving these goals by enhancing access to fresh, locally sourced produce for children through farmers markets, and establishing strategic partnerships with educational institutions and local pediatricians to garner support for the intervention and expand its reach to additional urban areas. Lastly, we will conduct regular assessments of the intervention's impact using reported pediatric health data and health assessments to ensure objective achievement and to implement necessary adjustments.
So basically, the way our intervention is going to be set up is we're going to have 4 groups, as mentioned earlier. One group is going to get both more access to parks and access to farmers markets. One will get more parks, one will get access to farmers markets, and one will receive neither, and that will be our control group. Now, the way we're going to try and control for external variables is to try and match this urban groups of children so that they're as similar as possible before the trial begins. And the inclusion criteria we're going to use is children between the ages of 5 and 13. And the exclusion criteria is going to be all people either before that age group or after that age group. Now, what we're going to measure during the experiment is going to be 2 short-term measurements and 1 long-term measurement. The 2 short-term measurements are going to be steps taken measured by pedometers and vegetable consumptions measured by household measures and pediatrician measures. And then the long-term metric we're going to use is BMI, which is going to be measured before the experiment, after the experiment, 5 years down the line, and 10 years down the line. So for our experiment, the duration of it is going to be 1 year for all groups. The frequency is going to be weekly access to farmers markets and daily access to parks. And the intensity is going to be basically a set number of hours that individuals can access the farmers markets and set hours that individuals can access the parks in order to try and control for as many external variables as possible.
So this logic model is kind of like a guideline that explains our thought process and our steps involved in this study. For the situation is that we're trying to study the impact of diet and exercise on childhood obesity, utilizing public parks and farmers markets. And for our input, we're utilizing funding, personnel, existing public farmers markets, as well as parks. And then some equipment we're using is pedometers, BMI from physicians' offices, and vegetable consumption information from parents. For this activities that we're actually doing, we actually designed this study, and we selected the different cohorts, groups 1 through 4, and then we collected the data on steps and vegetable consumption and BMI. For our outputs, this data that we collected will be utilized, is collected through utilizing pedometers and vegetable consumptions from parents and BMI from physicians that will be recorded. The short-term goals are increased physical activity in children, the improves vegetable consumption in children, includes increased community engagement, as well as increased utilization of public parks, roughly 20% in 1 year. Our medium-term goals are reduction in childhood obesity and prevalence throughout the experimental groups, and regular data collection and analysis, as well as enhanced farmers market food access by 15% in 5 years. Our long-term goals are a sustainable 15% reduction in childhood obesity, and the recommendations for obesity prevention, as well as expansion of this study into other communities. For our assumptions, we're assuming that there is a relationship between this intervention and obesity, and we're assuming participant compliance, intervention availability, as well as validity of the collection data and tools. Our expected impact is improved health and well-being of urban children, and obesity prevention and generation of actionable evidence, and promotion of healthy lifestyle.
The process evaluation will commence immediately after the implementation to determine whether the interventions are utilized as intended. The evaluation will focus on the sustainability of the parks for the child population to ensure sustainability, safety, and enjoyment to encourage physical activity. Certified playground safety inspectors in partnership with the town's Parks and Recreation Association will conduct initial and quarterly use and safety audits. Farmers markets will be assessed for capacity and safety, ensuring exclusion of invasive or harmful plant species and the use of agricultural tools and substances. The Department of Agriculture will evaluate farmers at the market events, and these measures all aim to monitor attendance and prevent harm while promoting healthy behaviors across the community that will positively impact the children. The outcome evaluation will analyze pediatric health data from the randomly selected intervention communities, measuring children's BMI and parental reports of their engagement with the interventions as indicators to demonstrate post-intervention change, with the goal of observing a 20% reduction in childhood obesity prevalence in 3 years. We hope to collaborate with pediatricians to collaborate with our program to track health outcomes and intervention utilization. The purpose of this analysis is to evaluate the effectiveness of the community interventions in reducing child obesity rates. The impact of the interventions will be compared between study groups to provide a basis for confirming the true impact of the interventions. Here is a projection map of our expected outcomes. As you can see in the yellow, this is without intervention. The BMI of the childhood population continues to increase. The combination of parks and farmers market intervention, we will see a decrease, and only one or the other of the interventions will have results in between those two.
Childhood obesity is a serious medical condition that affects a child's well-being. So our prospective cohort study would act as an intervention to target the factors that normally contribute to childhood obesity, and we're doing that on a community level. So through the provision of public parks and farmers markets, we would anticipate that there would be an increase in physical activity and also vegetable consumption in children. And this in turn would reduce the prevalence of childhood obesity by at least 15%. There would be frequent evaluation of the parks and the farmers markets to ensure that they're properly utilized. And the outcome of the intervention would be evaluated by BMI measurements of the children and parental reports to assess its effectiveness. And this is the end of our presentation. Thank you for listening.